Hypochlorite accident is a very important endodontic mishap and endodontic emergency. It is described as any event in which the sodium hypochlorite is expressed beyond the apex of the tooth. And the manifestations can be immediate or it can be after a few minutes to few hours, where the patient will experience severe pain, swelling, and profuse bleeding both interstitially as well as through the tooth. Now, sodium hypochlorite is a cytotoxic material, which is the reason why we use it, because it causes necrosis and it helps in elimination of bacteria from the root canal. However, when it comes in contact with the interstitial tissue, it results in hemolysis ulceration and causes inflammatory changes by inhibiting neutrophil migration and damage to endothelial and fibroblast cells. So, because of this, there is a lot of interstitial hemorrhage which is occurring, resulting in spontaneous swelling and bleeding. When we irrigate, we take the irrigant with the help of a needle into the root canal. Now, this should be expressed slowly so that it does not extrude beyond the apex. However, in certain cases, especially when we are using sodium hypochlorite as an irrigant, when we use a forceful technique where we push the plunger very hard, or even when the needle is bound or wedged into the root canal, we try to express the irrigant without disengaging it inside the canal. And in certain cases, especially young children or adults, where the root canal is very wide, the apical closure is not complete, or when there is apical resorption, there is easy extrusion of sodium hypochlorite beyond the apex. So, when this happens, the manifestation is immediate or it may take some minutes or hours, but the first manifestation is pain and swelling. The patient may also complain of burning sensation, and on observation, we can see edema and profuse bleeding both interstitially and from the root canal. In posterior regions, there may be trismus and airway obstruction. If there is maxillary sinus involvement, then patient may complain of a foul taste or chlorine taste in the mouth. Hypochlorite accident is a very important endodontic mishap and endodontic emergency. There may be breathing difficulty also. So, how do we manage a case of accidental infusion of sodium hypochlorite beyond the apex? The first thing to do is to aspirate the sodium hypochlorite via an empty syringe from the canal so that there is prevention of further spread of the irrigant. This can be done by aspiration with the syringe and drying the canal with the paper point. and we can inject saline also to dilute the effect of hypochlorite. Once the symptoms are under control, we can give a non-sitting calcium hydroxide dressing. The patient is advised to take cold compresses for the first 24 hours and after that hot packs, which will improve the circulation. The patient should be given analgesics to reduce the pain and inflammation. Antibiotics will be given if there is suspicion of secondary infection occurring. In severe cases, we can keep the patient under observation. Root canal treatment should be deferred until the symptoms subside. And when patients have complex medical histories, we should refer the patient immediately to the maxillofacial department. Now, sodium hypochlorite is a cytotoxic material, which is the reason why we use it, because it causes necrosis and it helps in elimination of bacteria from the root canal. However, when it comes in contact with the interstitial tissue, it results in hemolysis ulceration and causes inflammatory changes by inhibiting neutrophil migration and damage to endothelial and fibroblast cells. So because of this, there is a lot of interstitial hemorrhage which is occurring, resulting in spontaneous swelling and bleeding. The best treatment is always prevention. So to prevent sodium hypochlorite accident from happening, always keep the needle within the confines of the canal. So the working length can be marked on the needle with the help of a stop, and the solution should be injected as passively as possible. A side vented needle is a very good option so that it doesn't push the irrigant beyond the apex. Make sure that the needle is not wedged in the canal. Move it continuously up and down so that you are sure that it is loose in the canal, allowing the backflow of the liquid from the canal orifice. I hope this helps you to understand how to prevent sodium hypochlorite accident, and if it does occur, how to treat and manage such an accident. Thank you.